Well, good morning, everyone, and good afternoon to those of you in the States, and hello to those that are in other parts of the world. It's a pleasure to be able to welcome you to this seminar run by CRE Respond at the University of Queensland. This seminar, of course, is focused on the application of microsampling for improved clinical care. And we're very excited to have three fantastic speakers who will be presenting to us today. Before I begin the formalities, I just wanted to thank the sponsors of our research education program, without whom this isn't possible, these offerings that we provide. And so to Pfizer, Gilead, Baxter, MSD, and the University Hospital and NEAM, we thank you very much for the support that you provide to our centre to provide these educational offerings. Of course, all of the presentations that follow are recorded and are then made available on our YouTube channel. And we're very excited about the level of engagement that we get from people to view those videos, which makes sure that they are available for other people to view beyond those that are fortunate to be able to join us today. So as is the custom in Australia, I'd like to give an acknowledgement of country, and the University of Queensland acknowledges traditional owners of the lands on which we meet, which in Brisbane is the Turrbal and the Yagara people. We pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. So the program for today is that we will first have a presentation from Yamali Guerra Valero, who is a PhD student who's very, very close to receiving final word about her doctorate being conferred. And she's going to be providing some information as a bit of an introduction to microsampling and using the example of pediatric pharmacokinetic studies as a very nice application of how microsampling can be used. Then we're very fortunate to have Abby Leno from the University of Michigan, who's going to be presenting on home-based therapeutic drug monitoring model in kidney transplantation. And then Kevin Downs from the Children's Hospital of Philadelphia, who's going to be talking about the clinical applications of microsampling as well. So it's a very exciting program, a lot of breadth to it. And hopefully through this, you'll see how useful microsampling could be and get some ideas about some clinical applications as well as some clinical research applications which should be investigated for this. Now, as many of you will notice, and if those of you that don't notice, I apologise for that, but I'm not Suzanne Parker. Susie is our lead for microsampling research and translation in our group here at the University of Queensland. And unfortunately, she's unwell. We wish her all the best for a speedy recovery, which we hope is very close. But in her absence, and despite all of her fantastic organisation, we hope that this is going to be a very nice meeting. So thank you very much, Susie, for putting the program together and providing the organisation for this. My co-chair today is Paddy Mitre. And Paddy is one of our postdoctoral research fellows here in our group at the University of Queensland, and is someone who has brought a lot of high quality to everything she does. She brought that to us in our group here too. And so we're very excited that she can co-chair this meeting. Paddy is originally from Mexico, and I often tell this story to people that she came here as a visitor, and it was so clear to us how good she was that we asked her to come back to Australia and to work with us. And so it was wonderful for us that she has been able to do that. And I'd like to welcome her to the stage to introduce our first speaker.
Thank you, Professor, for that warm introduction.